All right. Good morning, Amy. So nice to talk with you.
Thanks for having me.
You're very welcome. Thank you for coming. Okay, so I'm going to read a brief bio, and then if you'd like to add any additional information, please feel free. So Amy van der Linden has been a physical therapist for more than 18 years and specializes in John Barnes myofascial release for about 9 or so, which is still really amazing, and pelvic health specialty for about 5 or 6 or so. So would you like to add on to that?
Well, I mean, that covers the basics, right? So, yeah, I mean, the myofascial journey has been extraordinary in terms of the manual therapy and the kind of all-encompassing healing stuff that I've learned with that. And then going into women's health from there has just been amazing. I work primarily with women doing pregnancy and postpartum, so love it.
Yeah, tell me a little bit more about it. So, like in your clinic, what do you really specialize or focus on? Who are the people that walk in the door?
So primarily women. I do treat men, which is rare in pelvic health, but primarily women. Some more towards menopause, having issues with incontinence or other pelvic floor pain, dysfunction issues. But the majority is definitely pregnant and postpartum women. I network with a lot of midwives and doulas here, and some moms groups and things like that. And so wanting to help them get their confidence back and feel like themselves again, whether that's return to work, return to exercise, just feeling like they can do the daily tasks and play with the kids without having pain or leaking or some of the other things that we just aren't so commonly discussing these days.
Yeah, so important. Which leads to the next question, because that's their overall wellness. So, what does wellness mean to you personally?
I think the word wellness is definitely one of those all-encompassing words to me. So it wouldn't be just physical, mind, body, spirit. Within my practice, obviously things are slightly more focused on the physical and the body, but definitely we talk about nutrition. I have a network here, and with the new space, I'm really excited to hopefully have some more of those types of practitioners in-house so that we can address multiple things. We'll be adding yoga, which I know you love.
Mm-hmm.
And so I just think wellness really is a great word for all of the pieces, the mind, spirit, physicality, and just helping address multiple areas for feeling great and being able to truly live life as opposed to just surviving or managing. We use that word managing. Ugh, that's icky.
Yeah, I love that. Yeah, that's very inspiring. So with that in mind, and the moms that maybe are moms to be that walk in the door, what is the biggest tip you find yourself giving to these females and males on occasion?
I would say probably just an awareness of one thing I cover a lot, and one reason I'm trying to bring in yoga is just reconnecting their breath. Pelvic floor. And so just getting them to have that connection between the diaphragm and the pelvic floor muscles. I try to do some education on anatomy, but only to the point that they would care. But we have 3 layers of pelvic floor muscles, and no one ever talks about them. I think we think of our organs, and we think, of that related to delivering a baby or related to sex, but we don't really think about all the tissue and the muscles that are involved. Like you would if you were going to a gym to just get stronger or to even improve in yoga, you would think about your quads or your glutes or your lats or deltoids. And so there's a lot of muscles down there, and so just awareness with how they move and how they breathe. And I think taking things past like, oh, do Kegels. It's pretty rare that I find someone where that's the only solution they need. There's often a combination of tightness that's probably contributing to the pain and then the weakness. So one of the biggest pieces that I do is just give them some actual information about their body. And for them specifically, okay, so you happen to be tight here, or you happen to be weak here. So I found these types of activities or exercises or whatever are best for that. And just being able to give them some of that individual evaluation, because there's a lot of great programs out there. Diastasis is another thing that I treat, or some people say diastasis recti. and where the ab muscles separate. And so there's a lot of great programs for leaking or for diastasis. And so, but women don't know where to start. And so they just kind of feel paralyzed. So I can at least give them accurate information about what they need, and then they can go back to the information that they had found. And that's often really empowering to them. And I can just bring them a lot of peace with just those bits of information.
Yeah, beautiful. If there is a mom, let's say she's listening to this and just wants to start that awareness in a general sense, how would you have her begin? Would she need to actually like lie down, maybe place a hand on her belly? How do you start that process of awareness? Whoops, I think we froze. Hello? Okay, I'm gonna stop this, but I'll re-record and come back. Oh, here we are. Hello.
Sorry, I don't know if that was me or...
It just froze. I'm not sure why. That's okay. There's a small little bleep, but we got it back. So did you hear the question?
You said, so if there's a mom listening.
Yeah. Cliffhanger. And she just wanted to start this general awareness of what's going on with her breath and maybe healing from a pregnancy, let's say. How would you suggest someone beginning? Would they actually like lie down and place a hand on their belly? How would you suggest them to start?
I think most people find it easier to relax laying down. And so I teach something called filling and emptying breath. And so, yeah, they can definitely lay down and sort of chest and belly. Obviously good diaphragmatic breathing, the belly fills. And so that's part of why I call it filling and emptying breath, so that they don't have to think about all the different moving parts. I want to think, I use the picture of a balloon. So if they were going to fill that balloon, the pelvic floor is, it almost be like an upside down balloon. So the pelvic floor is the base where the top of the balloon would get the most round and the most full. So they inhale, breath all the way down. And then as they exhale, things are just going to lift back up a little bit. So laying down is the easiest way to relax and do that. Some of them, I like having them sit like on a softer surface, like a couch or a soft padded chair, because then when they fill, they can feel a little bit of feedback as their like labial tissue and perineal tissue touches the cushion. And then as they exhale, they feel a little bit of that decreased pressure. So sometimes the chair can then give them feedback on their filling and their lifting, and that's sometimes helpful when there's no other feedback.
No, thank you. That's a very practical way to start. I like the title, the filling and the emptying. So how do you work wellness into your practice then?
So for me as a solo practitioner for so long, what that's looked like is bringing up the other things, bringing up stress. I talk a lot about how moms should all over themselves. Should do this, should do that. And so I'm very openly communicating with them about their home program, because the last thing I want is to add more shoulds and or to give them more things to have guilt or shame about of what they are or aren't doing.
Yeah.
We do talk about nutrition. I do talk about their sleep. Thankfully, you know, with the growth that's coming, I'm adding massage literally as of this week to the practice. So there'll be prenatal and regular massage available. And then, of course, when we're in the new space, we're going to be adding yoga and some of the other practitioners. I'm not 100% sure what that's going to look like just yet, but hoping to provide even more community for women here in Northwest Phoenix, and just workshops, information. You know, I hear all the time from women, oh, I wish I'd known about this with my first kid, or I had no idea there was physical therapy for your pelvis, or any of that kind of stuff. So just more things to help provide resources for moms. It's part of why I've started my podcast, and I love that we're all, you know, building this community and sharing information with each other. It's important. So
what's the title of your podcast so they can find you?
So it's finally our 6 episodes in. And so it's just now going to be on iTunes, but it's called Bellies, Babies, and Birth.
Oh,
and so it's really
love it.
Yeah, it's geared towards moms. So it's pretty low tech. Try not to get too medical or technical with things. Actually, my last podcast, I had two moms that had been clients on, just sharing from their perspective about pregnancy and delivery, and learning that they needed postpartum physical therapy and things like that. So it's been fun.
Yeah, what a great way to bring a community together too. Even from all across the nation, just the ability to hear other moms' journey and path. That's really great. So as a business owner, what's the biggest challenge that you find yourself having to overcome or work through?
Probably just the logistics. I'm so grateful that I finally have Cassie. She's our customer care specialist. And so she can help me really have the relationships and touch points with the clients that I'm wanting. But as the business owner, probably two main things. One, that time to work on the business, which when I'm there and I'm the therapist and I am the business, gets tricky. Boundaries of time, not always answering my phone just because I can, or I didn't turn it off and it's ringing. So just probably the system stuff, the technical behind the scenes stuff, better email systems, better follow-up systems, better, ways of communicating with clients who don't still know about what we do. And so that's probably the system stuff behind the scenes. My work is the easy part.
Yeah.
Treating clients is the fun and the joy. And I've had a bunch of babies this week. I had twins that were 4.5 months old yesterday, and I had 7-year-old twins earlier in the week, and a couple of 3-month-olders. So I work with lip and tongue tie babies and frenum issues, midline issues. And so they come in waves for sure. I'll go a couple months having no babies, and then I'll get a bunch of them. So
I think that's such practical challenge that most business owners face. I know I get that myself, the boundaries of time. So with that in mind, how, let's say, time is an issue, you have children of your own, a family, how do you work wellness into your day-to-day, into your life?
So it's funny, if you do any of those personal growth or self-help programs, like the physical stuff's always where I can usually score high. I try to at least get 7 hours of sleep every night. My nutrition's pretty good. I drink a lot of water. And I work out usually at least 4 days a week. And so that stuff, because I don't know, that's just always been critical for my sanity. So that part isn't really something I have to work at. It's built into my schedule. It's important to me. Yoga is one of the pieces that's missing the most, having to do my own stretching and things. So I'm very excited to get back to doing more yoga myself. But that part is pretty buttoned up in my life right now. That's one thing that I have a relatively good handle on.
Okay, good. Love it. Any parting words of wisdom that you'd like to share with anyone?
I think one of my main soapboxes lately has been, and it's a common one going around right now, is getting a tribe. I think, especially for women, that female connection, female friendships, people that have been through what you are going through is just really critical for not feeling alone, for not being isolated, for not even normalizing, because who cares about, I don't want to normalize things for women because what they're going through is huge for them. But from the standpoint of knowing you're not alone, then knowing that other people are on the other side of it is really encouraging. New moms, it's just a really unique season of life. And I think just being able to have some empathy and compassion for that, and finding a tribe where, we're supposed to be surrounded by sisters and cousins and aunts, and, the cliche, it takes a village, and that's there for a reason. And I just think I see it at our gym all the time. I'm part of a CrossFit gym, and we've had a bunch of new moms, and some of them are blessed to have family that live close and are involved in their lives, and some aren't. And the gym is our family. And, people are watching other people's kids, or telling other people's kids knock it off because they're climbing on something, or, helping clean up the mess after. It's just, you're not doing all of it by yourself.
Yeah, I think
And
that's huge.
do it all by ourselves.
Yeah, I had that discussion with my naturopath actually, that the burden that sometimes moms or even there's different burdens sometimes with like the dads and the moms, and it really comes down to we're isolating in these tiny little family units these days a lot of the times. And I know personally, like working through my own gene mutation, the Lynch syndrome, I have a few Lynch friends, and it's, on occasion just nice to talk with them because it's something that, again, it's like we work through our own challenges through different areas of life or even our family members. And it's just nice to talk with someone, they immediately get it, and there's no like kind of weirdness or anything when the big C word comes up. It's just like, okay, let's see, how can we provide support, and I know exactly what you're going through type of thing. So it is nice to have that tribe, as you say. I love it.
Yeah.
So share with us, where can people, so you shared your podcast, where else can people find you and get a hold of you? Maybe share your website, contact information, that sort of thing.
Well, like the filling and emptying breath. So my website is momentoftruthpt.com. And so the blog, there's a blog category. So the podcasts are linked in the blog.
Oh.
So you can't find it on iTunes yet. They're in there. I send out a Wellness Wednesday tip every week. And so those are all on there. So are a lot of videos. So like I have a video under my core tab for the filling and emptying breath. And so there's a bunch of videos on there as well. And that's momentoftruthpt.com. And then on Facebook, I'm at Moment of Truth Physical Therapy. I'm not into Instagram yet. So I don't think the podcast is quite on iTunes yet. You have to have 6 sessions recorded, and we just recorded the 6th. So that'll be getting posted on the website next week. But yeah, I've got blog posts on there. We do newsletters and different things. And so we try to share those out on the Facebook business page and on the website. So
love
that's probably
the content. Great. So I'm going to upload this to YouTube, and then I'll put the link there so people can find you. And then thank you so much for sharing your time and your wisdom this morning, this afternoon for you. Yeah.
You're so welcome. It's been great. I love the ways we're all trying to reach families, reach communities, reach our clients, and just provide more resources and info for them. So it's fun.
Yes. Yeah, I love it. Okay, I'm going to end this. Thank you.
Of course.